Today we will be discussing about Alloderm and Allograft in periodontal surgery. Allografts are freeze-dried, cell-free dermal matrices comprised of a structurally integrated basement membrane complex and an extracellular matrix in which collagen bundles and elastic fibers are the main components. The structural framework consists of a three-dimensional arrangement of the following. The first one being proteins, including a structurally intact basement membrane. Second goes intact collagen fibers and bundles to support tissue and growth, to provide the architecture and support for tissues and its vasculature, and to direct cell growth and behavior. Then there's intact elastin filaments for biomechanical integrity, and hyaluronan and proteoglycans for maintaining hydration and regulating growth factor activity. After placement, the patient's blood infiltrates the alloderm graft through retained vascular channels, bringing host cells that adhere to proteins in the matrix. Significant revascularization can begin as early as 1 week after implementation. The host cells respond to the local environment and the matrix is remodeled into the patient's own tissue in a fashion similar to the body's natural tissue attrition and replacement process. Cell components in the allografts are the targets of the rejection response. In addition, the ultrastructural integrity of the extracellular matrix, if damaged, would induce an inflammatory response in the body. A major advantage of Alloderm over skin preparations is the absence of the undesirable dead cells with their associated class 1 and 2 HDL antigens and potential transmission of cell-associated viruses. Furthermore, Alloderm has essentially undamaged collagen and elastin matrices and does not initiate an inflammatory response by the host recipient tissues, making it completely biocompatible. The use of allografts has been considered the most predictable procedure for keratinized tissue augmentation and vestibular deepening, as well as it eliminates the need for a second surgical site, thus decreasing post-operative morbidity. It is easy and less time-consuming to use, and aesthetically, it blends well with the adjacent tissue. And multiple sites can be treated in a single visit, causing less post-operative pain. The advantages of Alloderm and root coverage grafting include the following. Palatal donor surgery is avoided, unlimited donor tissue is available, multiple teeth can be treated in one visit, consistent quality of donor tissue, and a natural aesthetic appearance, as well as improved patient acceptance of therapy. Adverse effects on a client's oral health include infection, abscesses, pain, soreness, and inflammation and swelling. Audience that would benefit from the application of allografts would be audience that would require root coverage, gingival augmentation, or soft tissue augmentation around their implants. The first photo illustrates advanced gingival recession. The second photo, as you can see, shows how the alloderm is sutured and how the pouch is coronally positioned. The third photo shows the alloderm being placed into the mouth, and the fourth photo shows how 2 months later after the surgery, the root coverage is near complete and marginal tissue is thick and stable. Post-operative care includes systemic antibiotics for 10 days, chlorhexidine mouth rinse for 2 to 3 weeks, pain medication as needed, ice applied to the face for 24 hours intermittently at 10-minute intervals, cold liquids for the first 3 meals, no mastication or toothbrushing at surgical site for 2 to 3 weeks, removal of surface sutures at 2 to 4 weeks, and removal of subgingival sutures at 2 months. Alloderm is a promising material for tension-free covering of various periodontal surgeries. It can be concluded that a lesser but adequate amount of attached gingiva can be obtained using Alloderm that is sufficient to maintain oral hygiene and resolve persistent gingival inflammation. The sites show better aesthetics and blend with the surrounding tissues, causing less post-operative pain. Thus, findings suggest that Alloderm may be effectively used as an alternative to autogenous grafts for gingival augmentation procedures.